I'm TENECTEPLASE, and the next one who will present after me is UROKINASE, my cousin. We are both related because we are both thrombolytics. We will be both discussing about our drug name, drug classifications, pregnancy category, mechanism of action, pharmacokinetics, indications, contraindications, adverse and side effects, and our nursing responsibilities. For my drug name, my generic name is TENECTEPLASE, and my brand name is TENECTEPLASE and Metalize, and my chemical name is... Now for my drug classification. In my therapeutic class, I am a thrombolytic, and in my pharmacologic class, I am a recombinant tissue plasminogen activator. My pregnancy category is C, wherein animal studies have revealed evidence of maternal and embryo toxicity when given multiple IV doses. There are no well-controlled studies in human pregnancy. For my mechanism of action, my chemical effect is that I bind to fibrin and convert plasminogen to plasmin. Specificity to fibrin decreases systemic activation of plasminogen and the resulting breakdown of circulating fibrinogen. And my therapeutic effect is that I dissolve blood clots. My pharmacokinetics is that absorption is given through IV. The distribution is related to weight and is an approximation of plasma volume, metabolized by liver, and the excretion is unknown. And I have a half-life of 20 minutes to 2 hours, and the onset is immediate. My indications: reduction of mortality from acute myocardial infarction. For adults weighing less than 60 kilograms, then give 30 milligrams of 6 ml by IV bolus over 5 seconds. For adults weighing 60 to 69 kilograms, give 35 milligrams 7 ml by IV bolus over 5 seconds. Now for weighing 70 to 79 kilograms, give 40 milligram 8 ml by IV bolus over 5 seconds. Adults weighing 80 to 89 kilograms, give 45 milligram 9 ml by IV bolus over 5 seconds. And lastly, give 50 milligram 10 ml by IV bolus over 5 seconds to adults weighing 90 kg or more. The maximum dose is 50 mg. Contraindicated with persons who have hypersensitivity, arteriovenous malformation, aneurysm, active bleeding, intracranial or intraspinal surgery or trauma within 2 months, CNS or central nervous system neoplasms, severe hypertension, severe renal or hepatic disease, history of CVA, and increased ICP or stroke. Precautions to pregnancy, breastfeeding, children, geriatric patients, arterial emboli from left side of the heart, hypocoagulation, subacute bacterial endocarditis, rheumatic valvular disease, cerebral embolism or thrombosis or hemorrhage, in arterial diagnostic procedure or surgery within 10 days, recent major surgery, dysrhythmias, and hypertension. And side effects in the central nervous system is fever, intracranial hemorrhage, and stroke. Now in the cardiovascular system, my adverse and side effects are cholesterol embolism, coronary reperfusion arrhythmias, major hematoma, and minor hematoma. Now in the hematology, bleeding at puncture sites. For the eyes, ears, nose, and throat is epistaxis and pharyngeal bleeding. In the genitourinary system is hematuria. The last part that we will be discussing about me, the nursing responsibilities. For assessment, we must assess the underlying condition before starting therapy and be assessed regularly to monitor drugs' effectiveness. Second is monitor the electrocardiogram for reperfusion arrhythmias. Third, assess pain before therapy and reassess regularly. Fourth is assess patients and families' knowledge about drug therapy. We are finished with assessment, so let us proceed to nursing diagnosis. First diagnosis is ineffective tissue perfusion, coronary related to presence of blood cells. Second is acute pain related to myocardial infarction. Third, deficient knowledge related to tenecteplase therapy. In the planning and implementation, first, minimize arterial and venous punctures during therapy. Second, avoid non-compressible arterial punctures and internal jugular and subclavian venous punctures. Third, monitor patient for bleeding. If serious bleeding occurs, then immediately stop giving heparin and antiplatelet drugs. Fourth is cholesterol embolism, which is rarely related to thrombolytic use but may be lethal. Signs and symptoms may include livedo reticularis, purple toe syndrome, acute renal failure, gangrenous digits, hypertension, pancreatitis, MI, cerebral infarction, spinal cord infraction, retinal artery occlusion, bowel infarction, rhabdomyolysis. Teaching. Teach the patient or family about proper dental care to avoid bleeding. And is teach them to notify prescriber of bleeding, hypersensitivity, fast or slow or uneven heart rate, feeling of faintness, blood in urine, stools, and nosebleeds. Third, explain the use of drug to patient and family. Evaluation, patient regains tissue perfusion with dissolution of blood clots. Second, patient is relieved of pain. And lastly, patient and family states the understanding of drug therapy. I'll be giving the platform to my cousin.
I am UROKINASE. My brand names are TENECTEPLASE and the Bukinase. My chemical name is... I have two drug classifications. First is the therapeutic classification, which is thrombolytic, and the pharmacologic classification, which is an enzyme. I am categorized as category B in pregnancy category because there are no well-done studies of me that have been done in humans. But in animal studies, I am given to pregnant animals and the babies did not show any medical issues related to me. My chemical effects is that I activates plasminogen by directly cleaving peptide bonds at two sites. And my therapeutic effect is that I dissolve blood clots in lungs, coronary arteries, and venous catheters. My absorption route is through IV, and my distribution is rapidly cleared from circulation, and I am mostly accumulates in kidneys and liver. I am metabolized rapidly in the liver, excreted small amount in urine and bile, and my half-life is 10 to 20 minutes. My onset is immediate, and my peak is 20 minutes to 2 hours, with a duration of 4 hours. For my indications, lysis of acute massive pulmonary emboli and pulmonary emboli accompanied by unstable hemodynamics. For adults, for IV, infusion only by constant infusion pump. Priming dose is 4,400 kilograms over 10 minutes, followed with 4,400 kilogram per hour over 12 hours. Flush any of my remains in the IV tubing with a volume of compatible IV solution about equal to that of the tubing at 15 ml per hour. For venous catheter occlusion, in adults, instill 5,000 international units into occluded catheter. For my contraindications, I am contraindicated in patients with active internal bleeding, aneurysm, arteriovenous malformation, bleeding diathesis, visceral or intercranial cancer, ulcerative colitis, diverticulitis, severe hypertension, hemostatic defects, including those secondary to severe hepatic or renal insufficiency, uncontrolled hypocoagulation, subacute bacterial endocarditis or rheumatic valvular disease, history of stroke, recent trauma with possible internal injuries, or recent cerebral embolism, thrombosis, or hemorrhage. I am also contraindicated within 10 days after intra-arterial diagnostic procedure or surgery, such as liver or kidney biopsy, lumbar puncture, thoracentesis, paracentesis, or extensive or multiple cat dance, and within 2 months after intracranial or intraspinal surgery. IM, injections, and other invasive procedures are contraindicated during urokinase therapy. For adverse and side effects, my adverse and side effects in CNS are fever, hemiplegia, and stroke. For cardiovascular are reperfusion arrhythmias, tachycardia, transient hypotension, or hypertension. For GI are nausea and vomiting. For hematologic, bleeding. For respiratory are bronchospasm and minor breathing difficulties. For skin are phlebitis and rash. And for others are anaphylaxis and chills. For nursing responsibilities, assess patient's condition before starting therapy, and regularly thereafter to monitor my effectiveness. Assess patient for contraindications to therapy. Monitor patient for excessive bleeding every 25 minutes for first hour, every 30 minutes for second through 8 hours, and then once every shift. Pre-treatment with me affecting platelets places patient at high risk for bleeding. Monitor pulse rates and color and sensation of limbs every hour. Keep laboratory flow sheet in patient's chart to monitor PPT, PT, INR, hemoglobin level, and hematocrit. Be alert for adverse reactions and drug interactions. Assess patients' and families' knowledge for drug therapy. For nursing diagnosis, ineffective tissue perfusion, cardiopulmonary, peripheral, related to presence of blood clot, and effective protection related to drug-induced bleeding, deficient knowledge related to drug therapy. For planning and implementation, have type and cross-match RBCs and aminocarproic acid available to treat bleeding, and keep corticosteroids available to treat allergic reactions. Keep venipuncture sites to a minimum. Use pressure dressing on puncture sites for at least 15 minutes. Keep limb being treated in alignment to prevent bleeding from infusion site. Don't handle the patient unnecessarily. Pad side drills, bruising is more likely during therapy. To prevent recurrent thrombosis, start heparin by continuous infusion when patient's thrombin time has decreased to less than twice the normal control value after urokinase has been stopped. For patient teaching, instruct patient to report symptoms of bleeding and other adverse reactions. For the evaluation, patient regains normal tissue perfusion with dissolution of blood clots. Patient doesn't experience serious complications from drug-induced bleeding. And patient and family state understanding of drug therapy.
That would be all. We hope you learned something. Thank you and God bless!